Hello, all. Today I'm going to review a paper by Valeria Crivaro et al. Um, titled Pseudomonas aeruginosa in a Neonatal Intensive Care Unit Molecular Epidemiology and Infection Control Measures. So, this is a topic dear to my heart as my youngest was a 28-weeker in the NICU who contracted Pseudomonas while in the NICU, and the final strain he ended up being resistant to oral antibiotics. So I wanted to learn more about this. So let's start with some background information. So Pseudomonas aeruginosa is a type of bacteria that can cause a nosocomial infection and is found in various environments, including hospitals and healthcare settings like the NICU. It's also commonly found in water and soil and other moist environments. In the NICU, Pseudomonas can potentially be found in different areas such as water sources, medical equipment, healthcare personnel, and other environmental surfaces. Pseudomonas can thrive in moist environments, including water reservoirs like sinks, faucets, and other plumbing fixtures that you'll see within the NICU. It can also be found on contaminated medical equipment, such as respiratory equipment, IV catheters, on thermometers. These things can harbor Pseudomonas if they're not properly cleaned and sterilized. Pseudomonas can also be carried on the hands of the healthcare workers, and it can be transmitted to the neonates during procedures or routine care if they're not doing proper hand washing hygiene practices. And then other various surfaces within the NICU, including countertops, tables, and floors, can also be contaminated with Pseudomonas throughout contact with contaminated equipment or hands. Due to the vulnerability of NICU babies, the efforts to prevent the transmission of Pseudomonas and other pathogens are very important. And this can include adhering to like a strict infection control protocol, routinely cleaning and disinfecting all the surfaces and all the equipment in the NICU, and practicing proper hand hygiene, as well as monitoring the water quality within the healthcare facility. So, looking at the morphology, Pseudomonas aeruginosa is a gram-negative bacteria. It is rod shaped, and it also belongs, obviously, in the genus Pseudomonas. It's widely distributed in the environment. Like we said earlier, it's commonly found in soil, in water, and other moist environments. It's usually considered an opportunistic pathogen, so disease causing and opportunistic. And it can cause severe infections, particularly in immunocompromised individuals or those who have underlying health conditions. It's a non fermenter of glucose, and it does produce oxidase and catalase. And often, one of its unique characteristics is that it's got a very distinct, fruity, almost grape like smell to it. So, Pseudomonas in the body. So, Pseudomonas can infect various parts of the body, including the respiratory tract, the urinary tract, your skin, soft tissues, and your bloodstream. So, common infections caused by Pseudomonas include pneumonia, especially in cystic fibrosis patients. You also see urinary tract infection, bloodstream infections, which we call sepsis, and wound infections, but we see that a lot in burn victims. And there's also a lot of infections associated with medical devices such as catheters or nephrostomy tubes. Pseudomonas possesses several virulence factors that contribute to its pathogenicity. These include adhesins for attachment to host tissues, toxins such as exotoxin A and piocinin, as well as protease. And they also have the ability to form biofilms, which enhances its resistance to antibiotics and host immune defenses. You'll often hear that Pseudomonas is very sticky, and this is where that comes from. It has an ability to create biofilm, especially on medical equipment such as catheters. So, regarding the diagnosis of Pseudomonas, Pseudomonas infections often involve getting a culture when they are trying to be diagnosed, and these cultures of the bacteria can come from clinical samples such as your saliva, your urine, a wound swab, or even a simple blood draw. Identification can be confirmed through biochemical testing, and in some cases, molecular testing is necessary. When it comes to the treatment of Pseudomonas, Pseudomonas infections typically involve antibiotics, although antibiotic choices can be limited due to the resistance patterns. Sometimes combination therapy or the use of multiple antibiotics that have activity against Pseudomonas may be necessary. And some of the antibiotics that have this activity against Pseudomonas include the carbapenems, the anti-pseudomonal penicillins, cephalosporins, and fluoroquinolones. And some of these may be necessary. And in severe cases, you may need to do combination therapy. Pseudomonas also has the ability to develop resistance against multiple antibiotics through various mechanisms. Some of these mechanisms include efflux pumps, enzymatic inactivation of antibiotics, and also alteration of the target sites. This makes treatment challenging, especially in nosocomial or hospital-acquired infections. Seen here is myself giving my son a cefepime infusion in his PICC line when he ended up developing a Pseudomonas strain that was resistant to all oral antibiotic options. So now let us look at the study itself. So in the past, Pseudomonas outbreaks in the NICU have been relatively scarce. They occur, but it has not been a significant event. So an increase in incidence of Pseudomonas infections and colonizations were noted in a NICU of a university hospital between 2005 and 2007. For this study, we go to a NICU in a tertiary level hospital in Naples, Italy, which accommodates about 350 neonate admissions annually. Noticing an increase in Pseudomonas, they decided to test and analyze the molecular epidemiology and the susceptibility patterns of the Pseudomonas that they were seeing, as well as take and measure infection control prevention tactics that they were taking to limit the spread of the Pseudomonas in the NICU. So to do this, they took weekly swabs on the neonate's nose and rectum and screened them for Pseudomonas. Additionally, they took environmental swabs of things like the countertop and medical workers' hands. An education program on hand disinfection was carried out with the medical and nursing staff. Compliance with hand disinfection was evaluated throughout this observational study, and microbiological analysis was conducted using the conventional methods of antimicrobial susceptibility testing, but also genotyping via pulse field gel electrophoresis, and you'll see that in this presentation as PFGE. During the study period of July 2005 to June 2007, out of 616 neonates that were surveilled for healthcare-associated infections, 135 of them became colonized by Pseudomonas, and 72 patients developed some form of severe infection, and Pseudomonas was responsible for 11 of those severe infections. So Pseudomonas was also the third most common pathogen responsible for severe infections during the study period, following Candida and E. coli. All right, so here we see pulsed field gel electrophoresis. So this is a technique used in molecular biology to separate large DNA molecules by their size, and it's particularly useful in typing bacterial strains for this kind of study, and even in this is specifically Pseudomonas here. So analysis of this clinical isolate revealed 20 different genotypes within 48 patients, and this was responsible for 4 infections. So environmental sampling identified 7 additional strains, 2 of which those matched the clinical samples that were responsible for infections. So different strains of Pseudomonas may vary in their virulence and antibiotic resistant profiles. So understanding the specific strains that were presented in this NICU will help the healthcare providers tailor their infection control measures effectively to prevent the spread of this bacteria among these super vulnerable newborns. Identifying the specific strains can also help aid on where the initial source and the route of transmission of these infections comes from. So up top you can see MBO, so on and so forth. These are the different strains. And then on the right, these are the size. So the bands you're seeing are occurring at different size of these molecules. And so by comparing these, you can identify what strain you may have collected a sample from. So environmental sampling identified Pseudomonas in sinks and on the nurse's hands during the study, and that prompted further control measures to be activated. One of the things that was implemented was active surveillance, environmental sampling, and also an education program on hand disinfection. And a combination of all this led to a successful control of the outbreak in this NICU. Compliance with the hand disinfection improved following the educational program as well. So they were seeing more people actually being compliant with the rules they had in place for disinfecting and hand washing. So here we see a table that this is reviewing the 11 cases of severe Pseudomonas infection that they found in the NICU. So on the far left, we have the patient number 1 through 11. Subsequently, we have the gestational age. So remember that 39 to 40 weeks is considered full term. And you see here we have a few 24, 26 weekers as those who were infected. We also have their birth weight in grams. The next section we have the type of infection, whether it was sepsis, pneumonia, urinary tract infection, as well as the outcome of the patient. Lastly, we have a chart showing whether the strains of Pseudomonas the patient had was susceptible or resistant to 4 different antibiotics. So the first one's a combination antibiotic. The second one is imipinin. The third one is gentamicin, and the fourth one is Cipro. And next we have the antibiotic type, what it they ended up giving, as well as the PFGE, which was that electrophoresis test they performed to tell you what strain of Pseudomonas each infection was. So two things I would like to point out. We have 4 out of 11 of these infections were from the A strain of Pseudomonas. So there's a chance that all those came from one source. This was one source spread. So you can track the transmission of that. So I'd also like to note that we have four patients that unfortunately passed away. All four of those patients had fairly low birth weights to begin with, of about 1.5 pounds at birth. So out of those four that passed away, two of the patients had antibiotic resistant strains of Pseudomonas. But I would also like to point out that of those two patients that had antibiotic resistant strains, they had two different strains of Pseudomonas. One had the G strain and one had the O strain of Pseudomonas. So here we have another figure. So the line with the squares represents the infants that were colonized with Pseudomonas, and the line with the triangles represents the infants that were infected with Pseudomonas. The letters we see on the top represent infection control prevention measures that were put in place at the specific time in which the letters appear. So for A, this was the moment that there was an alert surveillance for Pseudomonas, and samples of strains were taken from clinical samples from the patients, and they were isolated. Contact isolation precautions were also reinforced. They were already in place because everyone's supposed to wash their hands as a healthcare worker, but they were reinforced at this point. So at point B, this is where environmental microbiological sampling started. At point C was when the results of the electrophoresis analysis, the results from that were reported to the staff members. And at point D was when the NICU implemented a 30-minute daily educational program on hand disinfection. This was started throughout the NICU for 1 week. So we can see that if you look at point B and D, about halfway through the graph, you can see that there's a downtrend the moment that they started implementing this educational program. There was a downtrend in both infections and colonization rates in the NICU. So what did we learn from all this? So first is that there was an emergence of antibiotic-resistant strains in the NICU, and that this poses a significant challenge, and it contributes to fatal outcomes in some cases, as we saw in those four patients. So if you think back to that table that I showed you, where patient number 4 and 5 both contracted antibiotic-resistant strains of Pseudomonas, despite having different genetic strains of the Pseudomonas. So this was thought to be the first account of two carbapenem-resistant, genetically unrelated strains of Pseudomonas to occur and cause two septic cases in the NICU around the same time. However, the study also wanted to underscore the effectiveness of infection control programs, incorporating active surveillance and following this hand hygiene and environment disinfecting protocol that is already in place in hospitals and in clinical settings. So this is my presentation. Thank you.